My name is Ariel Pablos-Méndez. I am the Assistant Administrator for Global Health at USAID. My responsibilities involve indeed the broad portfolio of global health work from Washington, but also around the world. We are at an inflection point in global health. It's a big transition taking place around the world. The success of development and the success of many of the efforts in global health are changing the landscape of the work of global health for all of us. There's also need for reforms in WHO, and that's an important point in this assembly, as well as the opportunity to promote the program of work of USAID, both with ministers of health as well as the WHO Secretariat. The theme of the reporting of the ministers in the plenaries, 89 of them lining up to speak to universal health coverage. And it's quite amazing. We were talking just before about how impressive the dream of ending preventable child death is, whereas the idea of universal health coverage, hard as it is for us in the United States, that the world, the developing world, can begin to see this not as something laudable but unrealistic, but actually something feasible, perhaps unavoidable. We are also very much engaged in the policy dialogues around reproductive health that Ambassador King has been very kind to host, and we had a great reception, great mood, a lot of progress, both from the family planning aspects as well as the impact of family planning in health and in what we call the demographic dividend. And most importantly, we are certainly here with special attention to what we're calling the call to action to end preventable child death. It's a big convening that the government of the United States, together with the government of India and Ethiopia, in collaboration with UNICEF, WHO, and other partners, are bringing a high-level discussion in Washington, June 14-15, to see a roadmap that will take us with political will, technical deliberations, and accountability to see the end of preventable child death. We define that as bringing undefined mortality in the world down to the levels today of OECD countries by the year 2035. We're very excited about that, and the traction and support of this has been really incredible.